Okay guys, I want to talk about how to do a proper posterior pelvic tilt and an anterior pelvic tilt. As soon as I get Ziggy to move out of the way here. Alright, so the first thing we're going to do is lie on our back. No, but you can't lay there. Come here. So once we're in this position, what I want you to do is lightly palpate your abdominal muscles and fire them away a little bit, just like tighten up, almost like you're doing a crunch. Okay? Feel how they engage. Once you feel that, we're going to work on doing a posterior tilt. A posterior tilt is when you flatten your lower back. Okay? You're bringing your pelvis posterior. All right? So with your fingers in your abdomen, you're going to flatten your back, trying not to engage your abdominal muscles, okay? So if you're doing a lot of abdominal contraction, you're essentially relying on your rectus abdominis to pull on your pelvis to flatten your back, okay? How we're working on today is we're trying to relax your abdominal muscles and use your deep lumbar stabilizers to do almost like a micro tilt posteriorly. So relax those muscles, tilt back, and relax, okay? Tilt back, hold, and relax. This movement is going to be important for progression of movement later, okay? It's a good movement to start phase one, or if you're not feeling so well, you're having a POTS flare-up, and you have to be horizontal, if you run out of surgery, your back hurts, any of those, it's a really easy movement to do once you kind of learn how to shut your abdominals down, okay? You can hold them for 5 seconds and relax, or you can just perform 10 of them and relax. All right, the second one, which is a little bit more difficult, is the anterior tilt. So the anterior tilt is the exact opposite, where we're arching our back. We're just kind of tilting the pelvis forward and creating an arch, okay? Normally, if we palpate our hands in our lower back muscles, you'll feel your extensors, your retrospinae, your paraspinals engage, the rod-like muscles that line the sides of your bony vertebrae, your spine. Okay, so if you do an anterior tilt and you feel those guys engage, mine are engaging a lot right now, then I want you to kind of reset, calm down, and try to tilt, almost like a micro tilt, using the deeper muscles in your spine, because we don't want those muscles to engage when you tilt. We just want our spinal muscles to engage. So it almost feels like you're allowing gravity to do it. It's a very, almost like a visceral movement. Just palpate those muscles. If you feel it engage, back off, reset, and try again, okay? So just forward tilting without firing your deeper or your superficial muscles. And again, do about 10 of those, so then you can actually work the whole continuum from posterior tilt to anterior tilt. Posterior tilt to anterior tilt. I hope that helps. If you have any questions, feel free to comment below, email me,